Dr. Becky Lynn, and I'm coming to you from Evora Women's Health. We're here in St. Louis. Evora is a full service gynecology practice and women's health practice. And we are concierge, which means that we really have the time to spend with you. You'll never visit in our office. We give you an hour the first visit. We love being able to provide this kind of care for our patients. I have been practicing gynecology for over 20 years. I'm a menopause and sexual medicine expert. So when it comes to sexual issues, I treat things like low libido, painful sex. Menopause, there are so many things that go into menopause, like weight gain, hot flashes, sleep problems, anxiety and depression, brain fog, short-term memory loss. The list is really long. But I wanted to bring you this Facebook Live today to tell you about hormone therapy, because hormones have gotten a really bad reputation over the last 20 years, and I feel like there's a lot of misinformation out there, and I want you to get your information from a trusted source like me. I'm an MD gynecologist, and I'm also a North American Menopause Society certified physician. Just a side note, if you're looking for really good information about menopause and a trusted good source that's evidence-based and scientific backed, go to menopause.org instead of just Googling and going down the rabbit hole of some craziness on the internet. So menopause.org is where you want to go. So I wanted to do this because I spend a lot of time in my practice saying the same thing over and over again, telling the story of where we are and what we know with hormone therapy today. So I'm going to go back a long time to the 1990s. In the 1990s, once a woman went through menopause, 99% of the time she got put on hormones. And the most popular formulation at that time was called Prem-Pro, which is a combination of estrogen and progesterone. It was one certain type of progesterone called Provera and one certain type of estrogen called Premarin. And we thought, based on not so high quality studies, that hormones could decrease your risk for cardiovascular disease. So the NIH at that time funded a huge study called the Women's Health Initiative. And they put some women, a group of women, on Prem-Pro, so estrogen and progesterone together, another group of women on Premarin alone, and then they had a placebo group. And their main goal was to see if hormone therapy could truly decrease the risk of cardiovascular disease. And the group of women ranged in ages from early 50s to up to almost 80, and the average age of women in that study was 63. But they stopped that study early in the early 2000s because they found that women on Prem-Pro, which is estrogen and progesterone together, you need both if you have a uterus, had an increased risk for blood clot, heart attack, stroke, and breast cancer. Women in the estrogen only arm had a decreased risk for breast cancer, and that hit the media like wildfire. I remember I was a resident at the time. Everyone was calling their doctors. Do I need to stop my hormones? Are these dangerous? Many women stopped their hormones and actually felt terrible, and it got so much media attention. But over time, they continued to collect data, and they also took the data that they had and broke it down by age range. So they looked at women in the 50 to 59 age range, 60 to 69 age range, and 70 to 79 age range. And they found different results when you looked at women age 50 to 59, which are the usual people who are just starting to have their period stop, just, having hot flashes, night sweats, sleep problems. And they found that in that age group, Prem-Pro, or estrogen and progesterone together, did decrease the risk of cardiovascular disease. That wasn't true if you were 60 to 69 and 70 to 79. But in that 50 to 59 age group, if you start hormones in that age group or within 10 years of your last menstrual period, it can decrease your risk of heart disease. And I know we're all terrified of breast cancer, but actually heart disease is the #1 killer of women. So this was huge. Also in that group, there was a decreased risk of overall mortality, which means a decreased risk of dying from anything. And there was no increased risk for stroke. The increased risk for breast cancer didn't matter by age group. So it was still increased no matter if you were in your 50s, 60s, or 70s. But since that study, we've learned a lot more about hormone therapy. So we typically don't use the Pro in Prempro, which is Provera. That is a synthetic progesterone, man-made. It doesn't exist naturally in our bodies. And the idea was that if women on Prempro together had an increased risk of breast cancer, but women on Premarin or estrogen alone had a decreased risk, then the thought is it the progesterone, the Provera, that specific type of progesterone, that is increasing the risk of breast cancer? Don't know, but possibly. We since then have been using, many of us, a progesterone called Prometrium. And Prometrium is bioidentical. And by that I mean it's just the same chemical structure as your own ovaries make. It does not mean it's made in a compounding pharmacy. It doesn't mean it's, super better than other progesterones, but it is bioidentical. And some studies have shown that Prometrium, which is micronized progesterone, does not increase your risk for breast cancer. So that's huge. So when we choose progesterones, we tend to choose progesterones that are the micronized progesterones because of that study, the Women's Health Initiative, that showed that women on Prem Pro, so the progesterone in the form of Provera, had an increased risk for breast cancer. So when it comes to that concern for breast cancer, and breast cancer is so common, we all know somebody or maybe several people who've had it. In my practice, we tend to choose Prometrium, which is bioidentical. There are other benefits of hormones. Hormones keep your bones strong. They help prevent osteopenia and osteoporosis, which is thinning of the bones. They keep your skin soft. They do that by providing moisture to the skin, less wrinkles. They certainly won't prevent wrinkles, but they can help. They keep your brain sharp. We're all worried about cognitive decline as we age, and when started early, I'm talking about hormones started between the ages of 50 to 59 or within 10 years of your last period, they can help maintain brain health, which is so important. Estrogen also helps improve insulin resistance. So when women go through menopause, they tend to gain weight. And actually, women, if they keep eating and exercising the same, will gain on average 1.5 pounds every single year. And nobody wants that. And women also tend to deposit fat around their middles. So their belly, or we call it, an air baby or a menopause. I've heard that before. And it's really frustrating that now, once you go through menopause and you lose that natural estrogen that your ovaries were making, now all your fat goes to your middle. But estrogen can help prevent that, less likely to do that, and also can help with insulin resistance. So let me back up and explain what insulin resistance is. And it's actually quite common around the time of menopause. It's not diabetes or pre-diabetes, but it's sort of pre-diabetes. So we all have insulin in our bodies, and when we eat something, that insulin level rises because insulin helps take glucose from your bloodstream and put it into, glucose from your bloodstream and put it into the cells for use by the cells. But sometimes it doesn't work very well, and that's what insulin resistance means. It's that your insulin isn't really doing a good job getting the glucose into the cells. And the more insulin your body pumps out, the more insulin makes you deposit fat, and the harder it is to lose weight. So I see so many women in my practice who say, I'm eating nothing, I'm exercising a ton, and I just can't lose weight. And so I will often check to see if they're insulin resistant, and that's not a standard test that we do for like screening labs, cholesterol, and all of that. But estrogen, that's another huge benefit, helps with insulin resistance. So I guess to sum it all up, there are so many benefits to hormone replacement therapy, especially when started in that 50 to 59 or within 10 years of your last menstrual period. And you might say, well, what about in my 40s? Or what if I stopped having periods at 43 or 45? And yes, there's absolute benefit. It is recommended by the North American Menopause Society and the American College of OBGYN to be on estrogen at the very least till the natural age of menopause, and the average age is 51. So if you're concerned about menopause and you want to preserve your health and you want to do something to decrease your risk for cardiovascular disease, or let's say you're just having terrible hot flashes and night sweats, hormones can have a tremendous benefit. They're not for everybody. There are certain contraindications to hormone use. People who've had a blood clot or a pulmonary embolus, or women with breast cancer. It is not recommended to use hormones, but for some women, they can have tremendous benefit. So I hope this was helpful. I hope this really enlightened you. One thing I will add here at the end is that I'm not a fan of pellets. I've seen a lot of people end up with like super, super high levels of hormones with pellets. They're not FDA approved. And being FDA approved means that the drug company had to prove that their hormones were safe and effective. So the pellets have never undergone rigorous study to show that they're safe and effective. So I really recommend FDA approved bioidentical hormones, which are out there, they exist. So that's all I have to say today. If you're interested in more information, please like our page. My website is evorawomen.com. Again, I'm Dr. Becky Lynn. Our phone number, our office phone, is 314-934-0551. And our goal is really to help you get through midlife in the most healthy way that you possibly can. So thanks for joining in. Bye-bye.